I'm Rachel Wall, founder of Inspired Hygiene, and I want to give you a couple tips today about advanced documentation. So I've talked in the past about clinical notes, the importance of clinical notes, and so we talk to a lot of folks about documentation. I'll tell you some of those that we follow and that we really consult with a lot are people like Dr. Roy Shelburne, Teresa Duncan, Christine Taxon, Delane that works with Practice Booster, and Dr. Charles Blair, the founder of Practice Booster. So I want to make sure we give credit where credit is due. We learn a lot of this from them, and I would really encourage you to seek out those resources and really utilize them in your practice, and we're always happy to connect you with anyone. But I want to point out a few things about advanced documentation. So the first key in advanced documentation, and we're talking about clinical notes here, is making sure that you have a template. So if you've got multiple providers in your practice, whether they're hygienists or assistants or dentists or administrative team, you've got to have some templates in place. And so we specifically teach hygiene templates, right? What prompts should be in each one of these templates, and you should have a template for your different procedures. You should have a different template for adult prophy than you have for perio maintenance. So make sure you have a template, okay? And I've talked about the pros and cons of templates in a previous video called Are You Asleep at the Wheel? So check that out. The second thing you want to make sure that you have is you want to talk about medical history. You want to make sure you've got some detailed notes about your patient's medical history and their risk factors in the clinical notes, so that when you do a fast attach, when you attach these clinical notes to your insurance claim, the insurance company and third-party payers can see what risk factors these patients have and how that might affect their dental care, right? The other thing is we need to make sure we're documenting this and how this affects the treatment that we do today. Anesthesia, right? Are they on blood pressure medication? Have we checked and evaluated all of that? Super important. Okay, last piece is diagnosis. We must document the diagnosis. Whether they're healthy or there's disease, we've got to make sure that we document the diagnosis. What level of periodontal disease do they have? Is it generalized? Is it localized? And what treatment are we recommending, obviously? And then last but not least, this is super advanced, and I learned this from the folks at Practice Booster, is when you're doing a periodontal maintenance note, you want to make sure you say in the note that this procedure included what would also be done in a prophy, in an adult prophy, because when that's documented and you attach that, then that legally allows you to request an alternate benefit of a prophy if the insurance company does not reimburse for the perio maintenance. So there's a ton more to this that we share with our clients and really help customize these templates and things for all the practices. Would love to talk with you about that, but just wanted to give you these few quick tips about advanced documentation. Thanks so much.